Okay. So Janet is here today for liposuction. Liposuction is simply taking the fat out from areas that you have not been really perfect in getting them by the weight loss or by other surgeries. So it's certain areas that are really stubborn that we're going to try to get them out through the liposuction. Liposuction is very popular, but it has to be very safe. So we're going to do 3 steps. We're going to go through 3 steps for that liposuction. The first step is to numb you, and we use something called tumescent anesthesia, which is a mixture of local anesthesia and some other medicine to make sure that you're completely numb for the area that we work with. So if we're going to do the area of the abdomen, we make sure that this area is numb, but not above and not below. And we have to make sure also that you're not too drowsy from that medication. You just have a safe line to take. The other area that we're going to be working on would be the hips and the back. As I said, there are 3 steps. So what's the first step after anesthesia? We're going to use one of our technology. So here we have the SmartLipo, which is a laser technology. And we also have the Vaser, that spells with a V, Vaser. Now that is an ultrasound technology. So the SmartLipo is a laser technology, and the Vaser is an ultrasound. What's the difference? Well, the laser will actually melt the fat, so as also the ultrasound technology, which is the Vaser. And the doctor usually will pick and choose depending on the area that we see fats. So certain area we're going to be using the SmartLipo, and the other area we're going to be using the Vaser on it. So that's the second step, which is just simply the technology to melt the fat, to break the cell borders so the fat will be liquid and come out. The third step is really the liposuction, which is taking that out. And we have a good technology here called the PAL, which stands for Power Assisted Liposuction. So instead of just like a shovel to take it out, the Power Assisted uses a technology which is radio frequency just to help that fat to come out. So that's the 3 steps that we're going to go through, but you're going to be really awake, you're going to talk to me, you're going to listen to music, and you're going to tell me if I ever hurt you. Okay? Deal?
Deal.
Deal. Start. So Janet, are you excited today?
I am so excited. I didn't hardly sleep at all. I couldn't wait.
You did not sleep last night?
Maybe a little bit.
I gave you a sleeping pill.
I know, but I'm too excited. I want to get going with this.
Well, that's great. A lot of people, for a change, they want to do something for themselves.
Yes.
Aren't you happy to do that?
I am very happy.
I think everybody should be excited when they do something for themselves. I think this is really great.
Yep, and this is my turn.
Okay.
Okay.
Good
Let's
to go.
get going.